Have you ever woken up in the morning, reached to turn off your alarm, and suddenly felt that sharp, stabbing pain shoot right through your neck? You freeze. You cannot even turn your head. That exact moment, that is what we are talking about today. And if this has happened to you once, twice, or every single morning, you need to watch this video until the very end, because what I am about to share with you could completely change the way you sleep, the way you move, and the way you start every single day of your life. This is not just another random tip video. Everything I am sharing today is backed by medical research from sources like the Cleveland Clinic, the National Institutes of Health, and Merck Medical Manual. So stay with me, because your neck has been trying to tell you something, and today, we finally listen. Before we dive in, if you find this kind of real, medically backed health information useful, please hit that subscribe button right now and tap the bell icon so you never miss a video like this one. We put out content that actually helps you live better, feel better, and understand your own body. Now let us get into it. So what exactly is happening when you wake up with neck pain? Your neck, medically known as the cervical spine, is one of the most complex and delicate structures in your entire body. It contains 7 vertebrae, dozens of muscles, tendons, ligaments, and critically important nerves that connect your brain to the rest of your body. When you sleep, your neck is supposed to rest and recover. But for millions of people, the opposite happens. By the time morning arrives, the neck has been under stress for 6, 7, or even 8 hours, and the pain you feel is the body's way of telling you that something went wrong during the night. The number one cause of morning neck pain, according to orthopedic specialists and sleep researchers, is your sleeping position. And the biggest culprit of all is sleeping on your stomach. When you sleep face down, your neck has to twist to one side for hours at a time just so you can breathe. Imagine holding your head turned to the right or left for 7 hours straight while you are awake. You would not last 10 minutes. But while you sleep, you do not even notice it happening. The muscles on one side of your neck become shortened and tight, while the muscles on the other side are stretched and overstrained. By morning, the damage is done, and the pain is waiting for you the moment you try to move. Research published in medical journals has confirmed that stomach sleeping is one of the leading contributors to musculoskeletal neck pain, and the fix is simple in theory but requires real habit change. You need to train yourself to sleep on your back or your side. Now let us talk about your pillow, because most people are sleeping on completely the wrong one and do not even know it. Your pillow has one job, and that is to keep your head and neck perfectly aligned with your spine throughout the entire night. If your pillow is too thick, your neck bends upward. If it is too flat, your neck drops downward. Either way, the muscles and joints are under strain for hours, and you wake up paying the price. According to medical experts, the best pillows for neck health are memory foam pillows, which conform to the exact shape of your neck and head, or feather pillows, which cradle the neck in a neutral position. However, feather pillows lose their shape over time and should be replaced every 1 to 2 years. If your pillow is old, lumpy, or you have had it for more than 2 years, that may be the single biggest reason you are waking up in pain every morning. Another cause that many people overlook is sudden movement during sleep. This includes tossing and turning, flinging your arms, or even the dramatic jolt of waking up suddenly from a vivid dream. These rapid movements can strain the delicate muscles of the neck, creating inflammation and tightness that you feel when you first open your eyes. If you sleep restlessly, this alone can be enough to cause significant morning stiffness. Previous injuries also play a much bigger role in morning neck pain than most people realize. Conditions like whiplash from a car accident, sports injuries, or even a fall that happened days or even weeks ago can have delayed effects. You may go to bed feeling completely fine, only to wake up with your neck locked in pain. The body's inflammatory response can take time to fully develop, and nighttime, when you are still and not distracting yourself, is often when that inflammation fully sets in. Beyond sleep-related causes, there are underlying medical conditions that can make morning neck pain a chronic, recurring problem. Osteoarthritis of the cervical spine is one of the most common. This condition involves the gradual breakdown of cartilage between the vertebrae, leading to stiffness, reduced range of motion, and pain that is often worse in the morning because the joints have been still all night. According to the Cleveland Clinic, cervical osteoarthritis is extremely common, particularly in people over the age of 40, and it often goes undiagnosed for years because people simply accept the morning stiffness as a normal part of aging. It is not normal. It is a signal. Nerve compression is another serious cause. When a disc in the cervical spine herniates, it can press against the nerves that run through the neck and into the arms, shoulders, and hands. This creates not just neck pain, but a radiating, burning, or tingling sensation that can travel down the arm. The Merck Medical Manual notes that poor posture during the day, sitting at a computer for long hours, looking down at your phone, and hunching your shoulders can all accelerate the wear on these spinal discs and increase the risk of herniation. So even what you do during the day directly affects how your neck feels the next morning. Now let us talk about what you can actually do to get relief, starting right now. If you woke up this morning with neck pain, the first thing you should do is apply an ice pack wrapped in a cloth to the sore area for 20 minutes. Ice reduces inflammation and numbs the acute pain. Do not apply ice directly to the skin. After the first 24 hours, switch to a heat pack for 20 minutes at a time. Heat relaxes the muscle fibers, increases blood flow to the area, and helps release the tightness that has built up overnight. This simple hot and cold protocol is recommended by physical therapists and supported by clinical evidence. Over-the-counter anti-inflammatory medications like ibuprofen can also provide meaningful relief for short-term neck pain. These medications reduce the inflammatory response in the muscles and joints. However, they should not be used as a long-term solution without consulting a doctor. Gentle movement is critically important. One of the worst things you can do with neck pain is stop moving entirely. When you immobilize the neck, the muscles become even tighter and the stiffness worsens. Instead, try slow and gentle exercises. A simple neck rotation stretch involves standing up straight, slowly turning your head to the left until you feel a mild stretch, holding for 10 to 20 seconds, then rotating to the right. Repeat this 3 or 4 times on each side. This exercise, done daily, can significantly reduce the frequency of morning stiffness. Another excellent movement is the face clock stretch. Lie on your back with a soft rolled towel under your neck. Visualize a clock face and use your nose to slowly trace the outer edge of the clock, first clockwise and then counterclockwise, 5 times in each direction. This gently mobilizes every muscle and joint in the cervical spine. There is also the head press exercise. Sit straight, place your palm against your forehead, push your head gently into your hand while keeping your head still, hold for 10 seconds, and repeat 5 times. This builds the deep stabilizing muscles of the neck and reduces vulnerability to injury. For long-term prevention, the changes you need to make are straightforward but require consistency. If you are a stomach sleeper, begin the transition to side or back sleeping. Place a pillow between your knees when sleeping on your side to keep your spine aligned. Make sure your pillow supports the natural curve of your neck and replace it regularly. Evaluate your mattress. A sagging or overly soft mattress can undermine even the best pillow by allowing your spine to curve unnaturally throughout the night. A medium-firm mattress is generally recommended for spinal health. During your waking hours, pay attention to your posture. Keep your phone at eye level instead of bending your neck downward to look at it. Position your computer screen at eye level. Avoid tucking your phone between your shoulder and ear. Take regular breaks from sitting and stretch your neck and shoulders throughout the day. These daily habits, repeated consistently, reduce the cumulative strain that builds up and expresses itself as morning pain. Regular physical exercise is also a powerful preventive tool. Strengthening the muscles around the cervical spine through consistent activity creates a natural support system for the neck. Research published in the National Library of Medicine even highlights the role of breathing exercises in reducing neck pain by improving respiratory muscle function and reducing tension in the accessory muscles of the neck, which connect directly to the cervical region. Now, most cases of morning neck pain are benign and will improve with the strategies we have discussed. However, there are certain warning signs that should prompt you to seek immediate medical attention. If your neck pain is accompanied by fever, it could indicate an infection or, in rare cases, meningitis, which is a medical emergency. If you experience numbness or tingling that travels into your arms or hands, this suggests nerve compression that needs professional evaluation. Chest pain combined with neck pain can be a sign of a cardiac event and requires emergency care. Difficulty swallowing, a lump in your neck, swollen glands, or pain that radiates down your arms or legs are all symptoms that a doctor needs to evaluate promptly. Do not ignore these signs and try to manage them at home. So to bring everything together, morning neck pain is extremely common, but it is not something you simply have to accept. In the majority of cases, it is caused by controllable factors. Your sleeping position, your pillow, your mattress, your posture during the day, and your level of physical activity. By addressing these factors one by one, applying the home remedies when pain occurs, and doing the strengthening exercises consistently, you can dramatically reduce or completely eliminate the neck pain that has been stealing your mornings. Your cervical spine is a remarkable structure. It supports the full weight of your head, which is approximately 10 to 12 pounds, throughout every moment of your waking life. It deserves the right environment to recover and heal while you sleep. If this video gave you value and real, actionable information, please give it a thumbs up, share it with someone you know who wakes up with neck pain, and subscribe to this channel if you have not already. Hit that bell icon so you are notified every time we release a new video. We are here to give you medically accurate, genuinely helpful health information every single week. Take care of your neck. Take care of yourself. And we will see you in the next one.